So hello, everyone. Good afternoon. I hope you've been enjoying the conference. My name is Jennifer White-Reed, and I am so thrilled and so appreciate that you've joined Zoom Room A for the Collaborative Systems Trauma-Informed Services for People with Pets. I am the Senior Vice President of Domestic Violence Residential and Legal Programs at Urban Resource Institute. I will be this session's moderator, and I'm so pleased to help guide this conversation. As someone who has been working in the domestic violence residential field for many years, I have witnessed the evolution of services available to survivors of domestic violence, and notably the growth of co-sheltering and innovations that support pets. However, despite this growth, there is still an exceptional amount of unmet needs for survivors of domestic violence and others experiencing homelessness with pets. And conferences and conversations such as these are necessary to make even greater change possible. URI is committed to increasing knowledge of the intersection between domestic violence and animal welfare, reducing barriers to safety for survivors fleeing abuse, and highlighting the need for additional co-sheltering programs across the country and the world. As a human services provider, we also know the importance of providing trauma-informed care for individuals and families served by our organization. And our PALS program is no exception. Although PALS is our pet program, its purpose is to better help people by also helping their pets. This session today will focus on understanding the impact of trauma on humans and animals, especially during moments of crisis, and how co-sheltering and other pet programs can center the needs of their human participants while also helping animals. We have a wonderful group of speakers today, 4 wonderful speakers, and I look forward to the informative conversation. So I want to now turn to our first speaker. Our next speaker, Aaliyah Simpson. Aaliyah Simpson is the program manager of marketing and communications for the Pets for Life program within the Humane Society of the United States. She's an avid cheerleader for the human-animal bond and socially conscious animal sheltering. For 15 years of experience, her 15 years of experience in animal welfare has given her an in-depth perspective of the underlying systemic issues in communities that can create challenges for both animals and humans alike. Throughout her career, she has worked with various animal welfare organizations to develop and advocate for programs that improve pet owners' access to care and promoting DEI initiatives within animal welfare. Thank you for joining us, Aaliyah. Please take it away.
Thank you so much, Jennifer. Thank you for having me all. So hello, everyone. As Jennifer said, my name is Aaliyah Simpson, and I currently work for HSUS Pets for Life. And today I'm going to talk to you about how we can provide empathetic access to care, especially while being in animal welfare organizations. Next slide, please. So before I go in, I just want to tell you a little bit about the program that I work for, which is Pets for Life. Our program is driven by social justice, and that because we truly recognize that the deep connections between pets transcend boundaries of social, economic, race, ethnicity, and geography. And no one should be denied the opportunity to experience the benefits and joys that come from the human-animal bond. And that's something that drives us and myself in this work. Next slide. We do this with a 3-pronged approach. The first part is directly addressing inequity and lack of access to pet resources. We have 2 programs that we work directly in Los Angeles and in Philadelphia. The second part is to increase community-based animal welfare programming throughout the nation. And so we mentor other organizations who are willing to do this work and provide them access and how to do that door-to-door outreach and to really work within the community. And also with talks like this today, where we work with our animal welfare industry to help dismantle discriminatory policies and systems. Next, please. Just a quick update of a few results. We've, since our work has started, we have helped over 215,000 animals, pets. We have provided over 135,000 spay and neuter surgeries and over 625,000 medications and supplies provided. This is just a quick summary of what we do. So next slide. So before we jump into like how we can practically apply this, I always want to start off by talking about why is it important? Why does it matter? And animal welfare is connected to larger systems. And I think that we as a field sometimes forget that we are not a silo and that we are actually part of the larger social network for people and pets and helping the community. But we have done a really good job at making pets be the focus and that showing the plight and issues that happen in pets. But when we do that, we forget that there's a whole ecosystem out there that actually does affect that animal. And so what we're asking for in doing this work is that not to undershadow the animal, but to show, and if you mind hitting the next slide, the entire picture. And so that way you can also see that pet with their person and in their entire environment and how that interplays. And if we're able to do a holistic approach in looking at this, we're not only going to make a better impact for the pets in our community, but for our entire community as a whole and at the animal welfare movement. Next slide. So before we jump in, there's into the practical work, there's two really important pieces that I want to talk about. Because a lot of times when people start this work, they're like, yes, I'm ready to go. We're going to make all these programs and help people. But I think there's two pieces that can actually kind of put in a pitfall. And the first part is understanding what is actually empathy. And if I have a short video by Dr. Brene Brown that I really think summarizes that. If we can click the video. I think the volume is not on. When you switch to the Zoom, I think there's a little thing you have to check that says play volume on that side. I know it's.
Oh man. Michael, they're your cousins.
Ads.
Look at me.
Am I just hitting that skip ad button?
Here I am. Right
at the corner. There we go.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, you can climb down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, no, you want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. Yeah. And we do it all the time. Because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So, I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now. I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
Thank you so much for that. And yeah, and I think that's the kind of, once we get back to the slides, But the part I want to point out from that video that's so impactful to me
People with
is that
ADHD
idea.
save 10 hours studying with this
Oh,
Chrome
I
extension.
think
But
there's,
no, by all
I
means,
think
go
the
ahead, skip
video.
the ad, save a few seconds.
I have to do.
Uh-oh, okay. Seems like there's technical difficulties. But anyways, while we wait for that, just wanted to go back and talk about the part of empathy. So it's really the idea of trying to put yourself in someone's shoes, but also just letting yourself become emotionally vulnerable to do that point. And that's why empathy is a little bit harder for some people to navigate, because it really is different than sympathy. It's that connection. And that's what we're going to talk about today, putting that connection into the work that we're doing so that way we can provide the best service for people and their pets. And then once we get to the next slide, any luck? If not, okay. Let's see. Yay, perfect. I think we're getting there. Technology, it's always fun. All right, so the next piece of that is really important before we jump into this work is acknowledging the racial and social injustice of animal welfare. We talk, and throughout this conference, we heard a lot about how there's so many systemic issues that go into play that sometimes can bring people into crisis. And it's important to recognize that animal welfare is not excluded from that. We have also participated in systems and have created some systems that have created oppressive regimes that doesn't allow people to have access to resources. And it's something that we need to recognize before we get into this work. If we can hit the next slide, please. So this chart is just a few examples of ways that you can find this in animal welfare. If you want to see this chart in more detail, and at the end of the presentation, I'll put into the chat, we do have some tool guides from Pets for Life that actually you can find this in our sustainability guide. But it's just important to keep this in mind that when we're starting to reach out to communities, especially if you're starting to build a program for the first time, that sometimes like underserved communities have also been underserved by us. And there is a little bit of a mistrust there, or sometimes even hurt that's in that community. And so it's important that we go that with a sense of humility, and that we also recognize it's going to take time to build that trust. So just going in there, understanding that these are the systems that we have created in our field, whether intentional or not intentional, and that it's our responsibility to kind of break this down and to show that we're here in a way that's authentic and true, and that we want to make sure that all people in our communities are involved. And so a few examples I just want to point out from this, as we don't have time to go through all of them today, but this also goes all the way to structural, which I think some of the ones are more noticeable. So like why there's no vet care in certain communities versus others, but also important that while you're doing this work and working with other staff and yourself, realizing that those micro internalized things as well are sometimes even more impactful when we're trying to do empathetic access to care. So like understand, like sometimes when we say things of those are that, like, it was pets from that area, or people don't, or, assuming that certain individuals don't have the same value of pets that we do. So just really important to make sure that we're navigating those thoughts in a way that's honest with ourselves and challenging ourselves and making sure that we are being a true resource to our community. All right, next slide. So now that we got through those two pieces that we want to make sure, we're going to talk about the actual like nitty-gritty things. So the first part is cultural awareness. And so it's really important that we recognize the cultural makeup of our community, and that can go from anything from just from race, class, ethnicity, to languages that are spoken, to even different regional communities where people might be from. And that's really important too, because culture is a medium in which that people develop resilience. Like that's how we learn about ourselves in connection to the world. That's where we develop coping skills. That's where we develop what makes us, have joy. And so it's really important to understand that in the context of helping and working with people, if you're going to truly be able to have that connection and be able to go from an empathetic standpoint. Make a point to understand the cultural composition of your community that you serve. And it's important too that that goes by going to outreach. If your organization is able to, make sure you participate in other communities, like community events that don't even have to do with animal welfare, but just has to do with the cultures in your community. And also making sure that your staff is having ongoing cultural awareness training too. Another big piece is making sure that you recruit staff that actually represent the community that you serve. So if you have staff members that are within that community, they're the best person to talk to someone who's within that community having a crisis, because they already understand and have a connection to how that person may view the world. And so we're able to give the best possible care, and that person doesn't feel as alone going into this environment. Next slide. Safe spaces are really important too. And this is both physical and mental. So you want to make sure that you're removing, you're removing physical barriers between staff, volunteers, and customers, or any clients that you're serving. You want to make sure the spaces are clean and uncluttered and feel really welcoming and environmentally friendly. A great example that I have is like sometimes people will use little offices if possible to have these more difficult conversations, especially if a client is facing a crisis. You really want to avoid talking about these private matters in front desk areas, because you'll notice that people will, again, if you feel really exposed, you might not be able to give all the information that is needed for us to be able to provide the best sources of care for you, or to provide the best information. And if you are low on space, I always like to say you can get creative with it. Part of my work was actually in New York City. And as we know, New York City space is really limited. So sometimes it would, if all the spaces were filled, we'd just have to go outside and sit on a bench and talk. You can find creative ways of trying to make that space that person feel that they are removed from an audience and they're able to really talk to you one-on-one. Next slide. Establishing connection. Just as we heard in that video, and I'll say over and over again, empathy is about connection. And so if we do not establish that connection and trust, we cannot move forward in having an empathetic, we can provide services in an empathetic way. So the first part is making sure you introduce yourself. I think sometimes some of us are so excited to get the information that we have, and we know we have all this plethora of resources, that we forget that this person is going through a unique experience for them. And it's really important that we recognize that. So make yourself as equally vulnerable. Introduce yourself, say your name, also your organization and title, so that way they understand the best way that you can help them in this situation. Using door openers are really important. That's a door opener is a positive, non-judgmental response, usually an initial phase of contact. A great thing is that we work with people and pets. So oh yes, and that is a really good point I saw in the chat, pronouns as well. Please definitely make sure that you, in part of your introduction, your pronouns as well, and also offering to ask what their pronouns are. That's especially really helpful in working with people in the trans community, or people who are gender non-binary. But yes, those door openers are really important. So a great point, since you have pets, just talk about your pets. Sometimes it's a great way of talking to, let's know about Fluffy. How did you get them? Tell me a story about them. And sometimes that's a great way of building that connection. You want to use minimal encouragers. So these are while person's talking to you, that show that you're like brief interactions that show that you're paying attention. That could be nodding, that could be making direct eye contact, that could be a just to show that you are listening and that you're engaging, but you're not interrupting. And the biggest piece of this is active listening. You cannot have connection or empathy or empathetic access care without this piece. And active listening is making sure you're paying really close attention to what your client is saying. You're listening to understand, not to respond. And I think that can be very difficult when we're on our 15th client that day, and we've heard a similar story about this maybe 20 times, and we think we have the perfect resource, and we want to make sure we're going. We want to help them get that really fast. But when we do that, again, we're missing out on that piece of understanding, to this person, this is a really unique experience. So actively listen. And the best way you could tell if you are actively listening is that if you can't, after the end of the conversation, if you cannot relay what that person said back to them, but also the feeling of why they felt it was important to tell you that, then you probably didn't fully participate in active listening. And for people who are at the beginning of it, you can take notes. Sometimes I've had staff members that I've worked with who will tell the client, I just want to make sure I'm taking notes here if you're comfortable with it, so I can best assist you when we're done with this conversation. So, and again, making sure that person feels comfortable with that as well. Next slide, please. So after this point, this is usually the point where I have some people go, oh, Leah, that seems great. But what happens when you have the client who is like unable or unwilling to work with me at this time, and I just need to get through this situation? And I'm like, I hear you, and that can be very stressful, especially in our situations. But it's also important to recognize that people are going through a crisis can get over their threshold very quickly. We've all been there where maybe sometimes we were stressed out to the point where we just maybe didn't represent the best version of ourselves. But that still doesn't mean that we are any way less deserving of respect or care or the services that are provided. So it's really important to make sure that we remember that. But here are some things that you can do when someone's experiencing a very strong emotion, such as fear or panic, or they're really upset or agitated or too disoriented to talk. The first part is you can address their primary concern. Sometimes when people come to us, there's a lot of issues that are there and there's a lot of moving pieces that we need to address. And that can feel very overwhelming to someone who doesn't understand that system. But if we can bring it back to them saying that we are going to address your primary concern of why you're here today, we can kind of help people realign and realize that while it may seem overwhelming, we can focus on this one task. Provide a supportive presence. And this is going to be different for every person. Some people want you to be in that room and let them just have a minute to calm down. Some people would prefer if you were out of the room for a little bit so they can just have a second to calm down by themselves. And you can ask them, what can I best do to help you right now? And we can see, and sometimes just gives them a little bit of time to regroup and make things a lot better. Offer something tangible. Sometimes handing someone a drink or a tissue can help them redirect, and they can help them refocus on behavior. And you can always get support, enlist support. Sometimes that can be other coworkers. Like sometimes we know that the one coworker that can respond to certain people better than others, or it can be if that person is there with a family member or a friend, they can sometimes even help too, and you can just leave the room for a few minutes. And you can help provide focus. So sometimes we'll have situations where like you can give that person a tangible, meaningful goal to do that day. Even if that goal is, hey, I understand that you are very overwhelmed right now. Let's focus. How about you give me a number or a way to contact you so we can refocus on this in another time or in a few more hours or whatever they need. But if you give someone maybe just one specific task that they can do that doesn't feel overwhelming, that can go a long way. And again, everyone is different. So not all these tasks work all the time. It's about kind of, again, that goes where that empathetic care comes, understanding that we've all been in situations where we've been overwhelmed or scared or feel hopeless and powerless. And we are trying to make this situation better for that person. And we're not here to judge, and we're here to help. Next slide, please. Partnerships and referrals are so important for this. You do not have to do this on your own. So a good example of ways that you can work with other organizations, especially human-based ones, are food banks and domestic violence programs. I have a list here as well that you can look through. But don't forget to also work with other traditional animal welfare services. That could be other organizations, low-cost vets, or even like the for-profit areas like trainers and groomers. You want to reach out to any organization ahead of time to gather information on cost, process, their time constraints, and sometimes even their program limitations. You don't want to refer people to a group that they're unable to assist because that wastes everyone's time. And the more frequent used referrals you have, it's best to develop a formal referral agreement so that way both parties can assist each other and make sure that they understand where they stand. Next slide. Communication is so key. You want to make sure when you're doing this work that you have multiple methods of communication for with you and your client. That could be phone numbers, alternative phone numbers, also provide different options versus text and email, time of day and locations to meet. Sometimes not everyone has access to phones or emails or sometimes even just other ways of communication. So it's really important to make sure that you find ways that you can interact with everyone throughout different means of communication. And have room for flexibility. Navigating a crisis causes unexplained conflicts all the time. So if you have really rigid rules, the program is probably not going to be to the best of its ability. So for example, if your client is facing eviction, you want to make sure you give them more than 2 weeks to find a new place. So just work with and you also want to make sure that when you're doing that communication, it's between both just the organization and that person. We try not to involve foster parents as well. Next slide, please. So I'm short on time, so I just want to make sure I summarize this piece really quickly, but boundaries is so key. Making sure you work with that your staff and volunteers understand that there are limitations to the services that we can provide. And sometimes that's really hard for us because we want to be able to do everything, but we cannot. And that's okay. And we don't want to make sure we promise things that are outside of our control. So it's really important to make sure that all staff know that we have the ability to do at least these 3 things. Even when everything else fails and we have nothing else to offer, we can provide information to people so that way our clients know that they have all the information that they can have to make the best decision for them and their family, even if it's very limited options. That you can provide them links to other resources from the community. So making sure that you collect all those resources ahead of time. And at the end of the day, we can provide an empathetic engagement, which is huge. We can make sure that that we are not creating any more trauma to this person is going through this really traumatic event by being compassionate and being culturally aware. Next slide. And so I just want to end by talking about compassion fatigue and compassion resilience. So compassion fatigue, we hear a lot in our field, and that's just a combination of burnout and secondary traumatic stress. And so I'm not going to go too deep into that, but I think the part that is really important is compassion resilience. And that's the ability to maintain our physical, emotional, and mental well-being while responding compassionately to people who are suffering. And that's a big reason why I feel like this empathetic access to care is so important in our field in animal welfare, because when we realize that sometimes there are situations where there's not a lot we can do, and that there's a lot of different layers of systemic issues that can cause suffering. But what we can do is to show that we are here. We can create that connection. And as long as we're doing that in a way that is true and connecting people and pets, we're able to make a difference in those lives. Next slide. Thank you so much. And if you have any questions, you can feel free to email me, and I'm glad to talk to you guys at the end of this presentation.
Well, thank you so much, Aaliyah. Pets for Life is an incredible program, and we're grateful for your perspective. Up next, last but certainly not least, we have my colleagues from Urban Resource Institute, URI, Colleen Parker and Lena Cohen.
Hello.
Colleen Parker and Lena Cohen. Colleen is the Technical Assistance and Training Coordinator of the Urban Resource Institute's People and Animals Living Safely PALS program here in New York City. She supports the PALS program's mission by developing and implementing education initiatives and providing direct support for both human and animal-facing service providers looking to support domestic violence survivors with pets in their communities. Colleen's career so far has spanned emergency vet medicine, social work, and public policy, giving her a very deep appreciation of the importance of the human-animal bond. She is proud to use these dynamic experiences in her work to promote the well-being and dignity of at-risk individuals and families, including animals they love. And Lena Cohen is our PALS supervisor at Urban Resource Institute with over a decade of animal welfare and human service work under her belt. She works hard to honor and preserve the human-animal bond while delivering client-centered trauma-informed care for families and single individuals navigating the domestic violence and homeless shelter systems in New York City. I want to thank both of them for joining us today, and I'll ask that they take it away.
Thank you so much. And thank you all for attending our talk today. We're really, really excited to be a part of this awesome panel and carry on the conversation. So let me go ahead and just share my screen here. Sorry, thank you so much for bearing with me.
Yeah. Going to be flying through this presentation.
Oh yeah.
After following Brenda and Aaliyah's really wonderful talks on trauma and trauma-informed care.
I have all of these Zoom pop-ups here. There we go. There you go. All right. So Lena and I are going to carry on the conversation that we've been having. The concept of trauma-informed care and the way it interacts with the human-animal bond was wonderfully defined. And then we got to talk more about what that looks like at the program level. And now Lena and I are going to talk about some ways that we try to apply those concepts in our day-to-day service provision at URI PALS. So really quickly, URI was already presented and introduced, so we won't spend too much time on this. I just wanted to quickly show you that we are a very large human service provider in New York City. And while we're very proud of our PALS program, People and Animals Living Safely, we're just one of many wraparound supportive services that we have at URI to support survivors of domestic violence and folks experiencing homelessness. And I'll quickly pass this over to Lena, and she can give you a quick overview on all of the different kinds of services that we provide here at PALS.
Yeah, so at PALS, we are doing domestic violence services sheltering with a focus on sheltering. We talk to people before they come into shelter if they are seeking services, referrals, and need help. But once they're in our shelters, we focus on pet-specific safety planning. We're making sure that they have supplies for their pets. We're making sure that they have access to veterinary care and that it's low cost or free. And then we're planning their discharge and where they're going to go after shelter, since New York City domestic violence shelter is a temporary situation. So that is kind of the whole view. It's a before shelter, during shelter, and after shelter kind of view.
Another thing that's really great is that we're able to also keep in touch with a lot of our clients after they leave shelter, keeping in mind that recovery from trauma is an ongoing challenge, and domestic violence is, of course, cyclic in nature. We make sure that our clients all know that they are free to reach back out to us at any time if they need any support related to both DV or their animals. And in our practice in New York City, we're just one small part of the domestic violence services that are provided here. As you can see on these figures, which we're short on time, so I won't read through all of them. The need in New York City is very great for domestic violence services. It's a big place. There's a lot of people here, and there's well over 100,000 cases a year of folks needing services to seek safety from domestic violence. One thing I do want to especially highlight here is the fact that 40% of families who enter the homeless shelter system in New York did so because they were originally experiencing domestic violence. So when we're keeping in mind collaborative systems and being trauma informed in all of the different service provision that we might be engaging with, it's really important to keep in mind that even if our services have nothing to do with domestic violence, ostensibly, it is very likely that folks have experienced that in the past. So these are all very fluid populations, and nobody's ever really dealing with just one thing. And of course, we have that interaction with the human-animal relationship. So we've had a few really great sessions so far in the conference about domestic violence and the ways that interacts with the human-animal bond. And it can show up in many different ways. So in order to be trauma informed in our interactions with survivors that do have pets in the family, it's really helpful to be aware of the many ways that this can show up, even in unexpected ways. So just like in interpersonal domestic violence, where you might experience physical, sexual, psychological violence, this can show up with pets in financial abuse, and not allowing people to have the money to provide their pet the preventative care that they need, get vaccinations and nail trims, just basic things like that. So, when we're being trauma informed, even if it might look like somebody's pet isn't being cared for in the way we might think they should be, keeping in mind that if they've experienced trauma and domestic violence, it might not be that they're a big air quotes bad pet parent. It might be because they've been experiencing financial abuse or psychological abuse. And isolation is another huge one. There's so many ways that this emotional attachment to pets is exploited by abusers, and it can come up especially we'll see with people with dogs who might look like their dog hasn't been trained to walk on a leash, when in reality the family hasn't been allowed to take their pet on a walk because of the control being exerted by the abuser. There are so many challenges that are faced specifically by survivors and service providers that are sort of shared. I think that it can often be tempting to see, as the previous presentation said, to sort of silo these issues and say, oh, there's challenges that our clients face, there's challenges that our service providers face, and then you have within the different service areas. But I really do feel in the reality and in our experience, a lot of these roadblocks are the same. We interface with service providers who might have different understandings of domestic violence or the human-animal bond. Likewise, our clients might, have different understandings of what's healthy in a relationship and what's appropriate, and that could affect their willingness to disclose and seek services. So when we are welcoming folks in and hoping to provide them our services, leading with that understanding that our idea of relationship health, domestic violence, the human-animal bond might be very different, and making sure that we're being open about that. We also already had a great introduction to the effects of trauma, and something that I think is really empathy building is that the effects of trauma on the human body can be really similar to the effects of trauma on the animal body, on our pets. It can cause fatigue, appetite changes. It can affect our physical health. It can cause people to shut down, not want to discuss things, forget things. And so when we're building empathy and leading with a trauma-informed practice, it can be really helpful to keep this in mind. Maybe my client isn't unwilling to go to her vet appointments. Maybe this dog isn't badly behaved or poorly trained. Oftentimes it's just the way that trauma is showing up. And it takes a long time to recover from that. So again, leading with that open mind and curiosity to really try to identify that is really helpful. When we are implementing our trauma-informed care, again, this was beautifully covered for the most part earlier, but I really appreciate the idea of actively avoiding re-traumatization. So anytime we are implementing a policy or interfacing with a client, discussing, having a tough conversation, trying to keep in mind a filter. Is this going to potentially replicate a pattern that a client experienced when they were in their traumatic situation? Is there a cultural viewpoint that I might not be keeping in mind, that if I challenge that in a certain way of communicating, that could be triggering for them? So, oh man, we're short on time. So when we're talking about trauma-informed care, I think that in our applied practice, it's really important when we're talking about strengthening relationships. Domestic violence is a relationship wound. It's committed by people that are intimately close to you, and it can really break your ability to trust. It breaks down your dignity in a lot of ways. So really, in our trauma-informed care at PALS, just one-on-one interfacing with our clients, we really try to strengthen our relationships with our clients and between our clients and their pets. And interfacing with their pets is a great way to strengthen that relationship. So, excuse me. I really appreciate the idea of co-regulation, which is the way that interfacing with another person or another animal can really bring down your nervous system, because your nervous systems can interact and read off of each other. I think this is a relic from back in the days where we were surviving in the wild, and that was really important. So Lena, I wanted to call you back into the conversation and ask you about what, if you have any experiences with relationship and the way that strengthening these relationships can make it, I guess, easy, facilitate your ability to provide services to clients and their pets.
I mean, so we have about 2 minutes left before we're going to have to stop for questions. So I'm going to make it very, very fast, talk about the role of dignity. I don't even know if we're going to be able to get to all of our slides, but the role of dignity when it comes to our clients and their experiences in domestic violence sheltering. And hopefully this can translate into anybody who's watching, especially our animal welfare friends. The most important thing is making sure that you maintain our clients' dignity, even if you don't always respect or don't always understand like where they're coming from. So one of the big things that we see in shelter is our clients are very hesitant to talk about spay neuter. Many of them are fine, but I feel like in the animal welfare sector, if you talk about not wanting to spay or neuter your pet, there is a loud, horrified gasp. Oh my God, not spaying and neutering the pets. And of course, this makes sense. When you come from animal welfare, there is a just birth of animals in shelter. We are thinking about that side of things, but we also have to take in mind why this person has these very strong feelings. We may have people who are gender nonconforming or trans who have very strong feelings about body autonomy, which speaks to the trauma that they've gone through. as people who have had like trauma visited upon them by a like cis heteronormative society, they may be a family who has had this dog and this dog's grandma and this dog's mom and this dog's great grandma, and they need to continue the line because they love their animal. I feel like a lot of these things we have to think about where a client is coming from, and if it's coming from a place of love, we need to kind of respect that. While, you know, informing them of why it's a good idea to spay neuter. Obviously, we don't want our cats or dogs or any other animals to get cancer. We can cut down on rates of cancer by spaying and neutering a huge percent. But at the same time, that might not be what a person wants to do, and they have the autonomy and the right to make that choice. And you have to keep in mind that people who are traumatized have had their choices taken away from them so much that you don't want to repeat that cycle, and you don't want to become a different facet of abuse in this person's life or trauma in this person's life by being like, well, no, you have to. So instead of focusing on the spirit of some of your laws, because in our program, that's one of our rules, we do want folks to spay and neuter as much as possible within reason. We want to follow the spirit of the law when it makes sense for our clients. You know what I mean? And so it is 3:25. I think we have to stop calling for questions.
Thank you so much, Lena.
Yes.
I mean, that's a great way to summarize what we were coming at with our contribution to this panel, is the idea of collaboration, not only being between our service providing systems, but between the systems and the clients, because they're the experts in their experience, and they need to be the ones driving. Dignity, we really do feel is the antidote to that shame and isolation. And yeah, so sorry we had to rush through this, but I hope that we were able to convey some important points. And I'll just pause for a moment on our contact information in case anybody would like to reach out to us in the future.
Please feel free to reach out. We are happy to continue conversations or answer questions.
Yes, we also are happy to have one-on-one meetings talking about this kind of stuff, give trainings, all kinds of things. So please reach out to us. I'm going to go ahead and stop sharing so that we can have a couple of minutes of questions and discussions before we get kicked out of here.
Thank you, Colleen and Lena. I so wish we had another hour. The conversation with all speakers has been phenomenal. We're going to now shift to our Q&A section. And I really encourage anyone who has questions or comments to put it in the chat. If you put your questions in the chat, I would greatly appreciate it. But I'm going to kick it off with one question, which is, and it's to any of you, a component of trauma-informed care is cultivating an environment of safety for those you're working with. And I know you've touched on it, but can you share some ideas of how animal welfare providers can cultivate safety for people experiencing homelessness with pets? And similarly, how those working in human services can cultivate safety for those who are concerned about their pets? And it's for any of you.
I would love to jump in really quickly and just say that for animal welfare people especially, don't go in thinking that someone's going to, on the first question or the first time you're talking to them, immediately be like, I'm in a violent, abusive situation. I am so scared. You know, imagine yourself in their shoes. Imagine how hard it is to open up to strangers. Imagine the judgment and the shame that you feel because society is telling you that you should be ashamed, like, you know, why didn't she leave? All of those terrible questions that you hear and are so common. Keep in mind that like that is something that they are carrying with them. And then to go to an animal welfare person and maybe they're scared that you're going to judge them because they have an animal who's potentially in danger too. So don't think that you have to do everything. The best thing to do is to reach out to resources in your community and kind of make these connections so that you can ask questions when you have somebody. Like there is a client who comes to the animal hospital. We are concerned it's a domestic violence situation. What can we do? Don't feel like it's just you. You're not in a vacuum. So reach out to the community partners that you have. And that's
sorry if I can jump in. Yeah, that's huge. Yeah, no person is an island. That's a phrase that I've heard a lot in my life. I'm sure y'all are familiar with it too. But yeah, no service provider is an island. I think a big part of cultivating safety, like you said, Lena, is it's on us as the providers to set the stage. So it can be as easy as reaching out to your local DV agency if you're an animal shelter or a veterinarian and saying, hey, do you have any posters or flyers that we could put up in our bathrooms or exam rooms? Make it very clear that this intersection is on your mind. Make it very clear that it's okay if you're going through this and you're a safe person to talk to. That is going to make it so much easier for somebody to speak up and say, hey, I saw your poster, instead of thinking, oh, well, it's a vet, they're not going to care, or it's an animal shelter, they might take my pet away if they don't think I'm caring enough for it. I don't, I'll stop.
Anyone else want to weigh in on that question?
I think they summarized it beautifully, so I want to hear other questions for the sake of time.
Sure, continue, participants, please continue to include questions in the chat. Another question that has come up is sort of language, about language. Given the focus on trauma-informed care, how can those working in homeless and domestic violence environments use the language of trauma-informed care to advocate for services that consider and accommodate pets?
I have an answer for this, but I'm going to wait and see if anybody else has anything to say first.
No, man, time is of the essence. Go ahead.
All right. I'll try to keep it brief. I think a huge thing is when we're advocating for services is having an understanding, again, that the folks that we're providing for have a lot going on, and the other service providers that we're interfacing with have a lot going on. So if it's hard to convince a service provider to provide for a person's pet, maybe we can say, hey, this is a protective relationship. Relationships are protective factors. The first part of this panel had laid out so many great reasons why the human animal bond is important. So it doesn't matter if you care about pets. You don't have to like pets. You don't have to personally think the human animal bond is important. But if we want to help survivors and folks experiencing homelessness, which is also very traumatic, preserving relationships and preserving dignity is the best way to do that. So that can be another door in.
I'd also say that to be trauma-informed care is to be trauma-informed at every level, and to just go in to the human service field knowing that those people are carrying a lot of vicarious trauma, complex trauma. They are dealing with a traumatized population, and they have to hear a lot of terrible stories, and they're overwhelmed because there are so many people who need help. And so trying to be solutions oriented, or at least focusing on what each can do, can be very helpful, I think, in creating bond there and being able to collaborate and work together. Explaining that, like, yes, we don't want to think about animals in human services because, oh my gosh, it's going to be another violent situation, or it's going to be another dangerous situation. There are going to be dogs running down the hallways. I literally had a professor that I'm working with who said he mentioned our program, and the students asked if we allowed alligators in shelter. So people are always thinking of the worst case scenario. And so you kind of want to highlight that, like, the first thing you can do is just ask questions of your clients, ask questions of these shelters and other providers to see, like, what kind of services are needed and what needs to be done. And then you guys can collaborate and work together to kind of fill in gaps.
And to kind of touch in on that piece too, I think the important part is recognizing their limitations as well, because I think one of the hesitations that happens sometimes when we cross the human space is that they feel like that we're not fully understanding of the work and the challenges that they go through. So just understanding that those relationships are going to take time, just like with everything else. It's not going to be overnight. And you can even start with, what can you do? Like, how can we assist each other right now? Like, how can we, if you refer a client to me that may be having an animal-based issue, and if I refer a client to you that's that may be having a human-based issue, and then what is your limitation? So that way we're not overwhelming, and that we're showing that we respect their field and their expertise as well. That really helps go a long way.
Thank you all for those amazing responses. I want to thank the speakers for your insightful comments and your experiences and dedication to this issue. I also want to thank the attendees for their questions and for participating in this panel discussion today. I wish our conversation could last longer, but I want to bring it to a close. And I know that there'll be a short recess and then the conference will continue. I also just want to give a shout out to Shoshana, who's been managing the tech with the slides and the video and all of that. I know it's hard work, but appreciate you all. Thank you again, and continue the conversation in the next session.